Dear Dr. Suraj Deepak Desai, I bring in all the wishes from Speed Medical Institute on behalf of all the faculty members of Speed Medical Institute for you to score rank number 6 in DM Anaesthesia paper in NEET SS 2021. Congratulations to you.
Thank you, sir. Thank you very much, sir. It is my pleasure, sir, to be a part of Speed Institute. Actually, I was taking test series during my NEET PG also. I was in Bangalore that time, and my classes were conducted very near to our college. And I had attended individual classes of biochemistry and few other classes before during NEET PG, and I liked it. And that time I used to solve only question papers from Speed basically, and now I had an opportunity to join Speed Medical Institute, and then in NEET as a super facility, I had the opportunity to join. It was a nice experience from Speed. I actually I used it very well. I took only 2 months course, just 2 months prior to the exam, and I attended all the classes. I could only view once because I had very less time. As I was working also. I was working as a senior resident in Maulana Azad Medical College, New Delhi. So I had attended all the classes once online, and after that I used the MCQs question papers which were there in this. So most helpful was the general anesthesia topics. Actually, it was taken by Sir. I don't remember. It was by Dr. Akilan, and the classes were very good. And sir made the concepts very clear. Actually, even after completing 3 years of PG, there were some concepts which were very like there was a complication which were confusing and which were difficult to memorize. So sir made it very easy, and I had viewed his classes twice, except from the other classes. I viewed general anesthesia classes twice, all the pharmacology, machine, and everything. So and I had attended all the question papers also from that, and because of the lack of time, I used to view all the classes in 1.5 or 1.75x, and sometimes 2x also. And this actually made me to cover it fast, and so that I can revise again and again. So that helped me a lot. And the second thing is MCQ. I got COVID positive just 1.5 weeks prior to exam. So I got 7 days leave that time, and I attended all the MCQs from Speed, and that really helped me a lot.
So you went through all the videos in anesthesia folder?
Sir, I didn't go through cardiac anesthesia because they were too long and lengthy. So I didn't go through cardiac anesthesia, neuro anesthesia, organ transplant anesthesia. Neuro and organ transplant was taken by madam. That was very good class. I don't remember ma'am's name. I think Vasanti
madam, Dr. Vasanti.
Vasanti madam. So that classes were also very nice, and ma'am used to make the concept very clear. And Akhilan sir's class, I visualized everything once or twice mostly.
So, I mean, where you completed your MBBS and where you did your anesthesia from?
I am basically from Karnataka, sir. I completed my MBBS from Bangalore Medical College and Research Institute. And I completed my MD anesthesia from Maulana Azad Medical College, New Delhi.
BMC is one of my favorite college because students have a lot of students from BMC as my students in Bangalore, and they used to attend class.
Demo class in when I was in second year MBBS, sir. When I was in second year MBBS, I attended your demo class. You took surgery class that time in the near BMC only. The classes you used to conduct.
IMA.
Yes.
In IMA auditorium. So it is very nice. Kalasipalayam and Tipu Sultan Palace, IMA auditorium, and nice, very nice, memorable places. I used to travel almost monthly, twice or thrice. And Good Shepherd Auditorium in MG Road, where I used to take regular classes.
Big halls, when there was less classes, they used to take there. It's a very big hall.
Yeah. So I mean, it's a great feeling, and students always be affectionate, and I have a lot of friends like you, a lot of friends from BMC and also from Bangalore, and a very nice place. So, and your preparation, to put it in a summary, the effective intense preparation for was 2 months before exam.
1.5 months basically.
So that 1.5 months you went all out, and he said, okay, I will do this full time.
Yes, sir. No, not full time, sir. Only when I was free that time, because I was working also. I used to get 2 hours maximum per day, And last 7 days I got a lot of time because I was COVID positive and I had a whole day of time. So I utilized all that time. But before that I could use only 1 or 2 hours per day.
Okay. So then when did you subscribe Speed Learning app?
Sir, I subscribed during November, I think October, November I subscribed.
Then who recommended you to do so?
So one of my friend recommended. He is also my colleague only. He started the classes from for critical care medicine, and he recommended me to join the class.
So I mean it worked then probably.
Yes, sir. It was worth actually.
So it is evident. I mean I cannot say probably. It is evident that going through classes helps. Structured classes, that's what is very important. You need to go through all these modules, 1 by 1, 2, 3, 4, 5. See, what happens is, in unstructured preparation of oneself, they will learn what they like, probably. And I mean, all area uniformly may not be covered. That's the problem in non-structured learning.
Yes, sir. And one more good thing about the app is that it gives a freedom to increase the or decrease the speed, that is 1.5 or 1.75x, because most of us, we won't have time to watch whole video, so we had to increase the speed and watch. So that is a very good feature of the app. I just like that the most about the app.
Okay, very, very nice. Nice to hear from you. What is the message that you want to give to the future aspirants of anesthesia and an anesthesia background, they want to do a super specialty in DM? For the upcoming exams?
Sir, I would suggest that they should have their concepts very clear. Then the exam actually becomes easier, and I would suggest that they should be clear about the general anesthesia topics basically than specialty anesthesia, because specialty anesthesia, half of them would be clear even if you have studied the anesthesia properly, and if you have read very well for your exams. As I was a fresher, I just passed out in August, so it was easy for me also. So I would suggest that they should be clear about general anesthesia topics and neuro anesthesia and cardiac anesthesia a little bit. That I would suggest they should read a little bit.
Very good, very nice. So, and time to thank, and whom all you want to thank, and who helped your career so far to
I would thank my parents and teachers from the beginning, and all my colleagues who helped really, so that they used to give me extra time to study whenever I used to work. So I would help everyone, and with a few of my friends I used to study for exam. I would thank them and my parents and teachers, sir. And I would really like to, I'm very thankful to Speed Medical Institute because I've been associated with it from a long time, and I'm very thankful to Dr. Senthil, Dr. Akhilan, and Dr. Vasanti. Because of them, actually, I would have learned so much topics because of them only. Thank you.
Excellent. I mean, this habit of gratitude and this habit of being and simple is the greatest quality that will lead to success. And I always acknowledge and I always wish that you will definitely make a great career in a super specialty anesthesia. I want to ask you, which anesthesia you are going to take? Which super specialty?
I would like to take organ transplant anesthesia, but I'm not sure if one of those, if three of those people who are in 1 to 5, if they take, I won't get it.
So how many seats are there totally?
Sir, there are 3 seats in Institute of Liver and Biliary Sciences, Vasant Kunj, New Delhi.
Cardiac anesthesia?
Sir, cardiac anesthesia, a lot number of seats all over India.
Neuro?
I think around more than 50, 60.
Neuro is also there?
Sir, yes, sir, yes.
So organ transplant only is less?
Yes, sir. Only 3 seats are.
Only 3. You want to do that? I'll sincerely pray from today until the counseling is there.
Yes, sir. Thank you, sir. Definitely.
So that you get one and you be happy.
Prayers come true. I would be really thankful to you all.
Sure. Definitely I'll pray. 100%. And so that other 3-4 people take a cardiac anesthesia, neuro anesthesia, and rest of anesthesia, and they don't take organ transplant, we'll pray. And so that you get in by this time itself. Okay, and you have to always do what you like, that's very important. And so I bring in all the wishes once again to you, and for a great career in a super specialty of an organ transplant anesthesia and a super specialty degree in anesthesia, and you are entitled to get on to a higher level of patient care, and definitely it will be a great experience for the patients and the people working around you, and you will definitely inspire them by doing things like this and achieving things like this, and we'll all be inspired and hearing the news about your achievements. The Dr. Suraj Deepak is doing wonderfully, and that will be a great thing to hear always. And I wish you that to keep happening, and your contribution to the specialty did be enormous. And also, any organ transplant today is the trend in the country, and you make a greater impact because the entire procedure depends on the anesthetic smooth flow of process, and definitely you have a greater hand in being the success of that procedure. So for all that to happen in thousands and lakhs and millions, and your golden hands to save more lives, let all happen wonderfully, and you keep moving to the next ladder of your career, and keep moving. For that, we always stand by you. We always wish you all the best and all the success in years to come as a great DM super specialty in anesthesia, in whatever anesthesia you do, organ transplant anesthesia and any kind of a higher scale of anesthetic procedure that you're going to encounter. Wish you all the best and all the success.
Thank you very much, sir. Thank you very much.
Thank you.
Really, really grateful. Thank you.